Hey, this is Doug Field, along with my co-host Ron Bachman. Welcome back to the segment of Healthcare Consumerism Radio, and we're pleased to have joining us on the program today the President and CEO of American Institute for Preventive Medicine, Don Powell. Good morning, Don.
Good morning, Doug and Ron. Nice to be here.
Yeah, good to have you with us. How's things up in Michigan these days?
A little dreary today, but at least it's not snowing, so we can't complain too much.
Well, I hope you have a white Christmas at least, though.
Yeah, thank you.
Well, hey, Don, for our audience, and we'll get into, kind of talking about the power to the patient, managing healthcare costs by managing demand, which I think is a great theme that you would like to talk to today. Give our audience kind of a brief overview of the American Institute of Preventive Medicine, please.
Yeah, we are a URAC-accredited wellness company. We have been in business for actually 31 years and present wellness through what we call the CALMER approach, which is an acronym for communication materials, assessment activities, lifestyle change programs, medical self-care programs, which will be what I'll be speaking about today, educational materials, and reporting. And we feel those 6 elements go into a good, sound, comprehensive wellness initiative.
Well, I appreciate that, Don. And, on the last segment, I'm not sure whether you were listening or not, but Ron and I were kind of talking about demand and accessibility. I think that's what you want to address. There's an overall concern in the market that we're going to face high increased demand, and there's going to be accessibility challenges. So, talk to that talk to that point if you would, please.
Yeah. Well, unfortunately, a lot of people just don't know when to access care versus when they can use self-care, and this helps increase the demand for services. You have patient preferences that also drive demand. You have some people that, at the sound of the sniffles will run to the doctor, and other people can have walking pneumonia and never see a provider. So when we try to empower patients to make better decisions, we teach them the skills that are necessary to know, these symptoms warrant going to the emergency room, or perhaps these symptoms don't require the ER, but I should call my doctor and let them know about them, or, these symptoms really are fairly trivial in nature, and there's really nothing a provider will be able to do, in which case, self-care is just as good. I like to use the saying that if you have a cold and you go to the doctor, you'll get better in 7 days, and if you have a cold and look in a self-care book, you'll get better in a week.
Don, this is Ron Bachman. The self-care issue when I was growing up was always my mom. She had a box of medications and pills in some drawer back in the bathroom area that she'd pull out at 2 o'clock in the morning when I was sick. She seemed to know what the medications were, what was appropriate for me, and that was the form of at least family self-care. It seems that the women in the family seem to be better at this than some of the men, at least in my family. How do we educate people a little bit more about the proper medications to have on hand to take care of things that may just require an over-the-counter drug to get through an evening without calling up the emergency room? What's the biggest challenge here?
There's really three good ways of getting this information. One, and seems to still be the most popular, are printed self-care books. We provide actually 14 different self-care books geared towards the needs of the group, whether it's families, retirees, women, children, even prenatal women and dealing with mental health issues. And other publishers of these books are out there as well. And they do work well, that, a mother in the family or the caregiver in the family can pick up this guide, and based upon the symptoms that they may be having or a loved one may be having, it will, in a sense, triage them to the appropriate level of care, whether it's this is an emergency, go to the ER right away. This is something doctors should know about, call your doctor or see your doctor. Or, the answers to the questions you ask are such that self-care should be applied, in which case the book will map out what to do from a self-care perspective. A lot of organizations also have access to nurse advice lines. So, in a sense, talking to a registered nurse is another way to learn what to do for physical as well as psychological symptoms. And then thirdly, This content is available online as well through a variety of organizations, so that people can access it electronically. Cell phone apps are also being commonly used for providing this type of content. And really what it comes down to is a lot of patients would, just as soon not go to the ER, but just don't know whether to do it or not, and it's after hours. The doctor is no longer open. They don't have a health care provider within the family, a relative that's a doctor or a nurse, and so their knee-jerk response is, my child's barking like a seal in the middle of the night, I got to go to the ER. Or I've had a fever and sore throat for 4 days, it's time to go to the doctor. So by educating the consumer on symptoms and the appropriate use of health care, we go a long way in terms of reducing unnecessary utilization. And as you said in the previous segment, it's rampant. Conservatively, 25% of all doctor visits are unnecessary, and 55% of all ER visits are for non-urgent care. And when you look at the average doctor visit cost of after exams, tests, and prescriptions, and the doctor visit of $199, and the average ER visit costing $1,349, you can see where a great deal of expense is occurring unnecessarily that costs either the employer or the provider a great deal of money, as well as the employee, since they're paying out of pocket with copays and deductibles.
Don, you kind of alluded to the access to nurse lines. Your program seems to fit well with the emerging telehealth market, with the emerging on-site, off-site health clinic, particularly, some of the retail clinics. Is that part of your educational effort too, is to really educate, the consumer on where they can go, before they actually have to head to the emergency room or think they have to head to the emergency room?
Right, and that's part of the communication campaign that goes along with our Healthier at Home Self-Care program. It's one thing to give a guide. It's another thing to know you have a 24/7 nurse advice line, or you can go online, but getting people to remember to do that on a consistent basis. So as part of the program, there's a variety of email blasts and postcards, as well as a monthly newsletter that serves to reinforce this whole concept of you need to be educated as a consumer, but continually utilize this education. A lot of companies we work with say, well, yeah, we did a self-care program. We gave out a book 4 years ago. Well, that's not a self-care program. A self-care program is something that's done on an ongoing basis and is continually reinforced, because what tends to happen over time is that people will use the resources initially, but then they kind of forget about them, and then they start going back to the doctor and ER when they don't need to. So communication is key, as in all aspects of health promotion and wellness.
There's two areas of preventive care that maybe you can help tie together for our audience. In one case, people may be hearing a lot under Obamacare about preventive care. It's covered at 100%. You have all sorts of services that they identify as preventive care. And now we're talking here about self-care, which is doing your own thing at home. And we're talking about that as preventive care. Can you kind of tie these two things together? Because somebody's saying, wait a second, I can go and get 100% coverage on these preventive care services that are required by law now. So bring those two concepts together for our audience, if you would.
Well, the preventive care services, the annual exam that you would have from your provider is a good screening tool and can alert you to potential problems that may occur down the road, or even, more immediately, whether it's because you have high blood pressure or high cholesterol or glucose levels that are abnormal. But when you talk about medical self-care, it's already when the patient has symptoms, that they are sick, and it generally applies more to acute care health issues than chronic conditions, but self-care procedures certainly can be used when diagnosing a chronic condition. But it's more the everyday health problems like earaches, sore throats, fever, vomiting, cuts and scrapes, broken bones, and so on. And so a preventive screening isn't going to help you in that regard. So really self-care or medical self-care applies more or less. Symptoms are already occurring. You're sick. There's some degree of illness. What do I do to treat that. And the thing I do want to emphasize, because sometimes people misconceive a medical self-care program that's put on by a company or by the insurance carrier, is that, they just want to prevent me from going to the doctor and they just want to save money. And nothing could be further from the truth. What medical self-care really is appropriate use of the healthcare system. Mm-hmm. So in the same way we can educate an employee to make a better decision about whether to access care or not, we also try to educate the employee who may have been ignoring symptoms that it's now time for them to seek care, to go see their doctor, maybe go to the emergency room when it's warranted. And I'll give you a case study, and there's many of them like this, but Lowe's Home Improvement has distributed our Health at Home book for many years, and I happened to be in a Lowe's about a year ago buying a kitchen faucet and asked the salesperson, without identifying that I was involved with the book, do you recall getting this book to help you make better health decisions? And he immediately said, you mean Health at Home? It saved my life.
Very good.
And I was a little taken aback, but I, once again was obviously very curious about that. Didn't say that I had helped write the book, and asked how so. And he went on that about 8 months earlier he had symptoms of abdominal pain and vomiting. He initially ignored those symptoms and went to sleep. When he woke up the next morning, they persisted. He decided to look in his book, which directed him to go to the doctor, which he did. By the time he got to the doctor's office, his body systems were starting to shut down. They immediately rushed him to a local hospital emergency room where the attending physician said, Jeff, had you not come in when you did, you'd be dead now because he had acute pancreatitis. So it cuts both ways, educating people to access care versus avoid care when it's appropriate.
Don, I really appreciate that, and that's a very interesting case study. We've got about a minute to go, and I want to give you 30 seconds or so to kind of leave our audience with a couple takeaways and how they can get in touch with you as well. Yeah.
Well, our website is healthylife.com. Our toll-free number is 800-345-2476, and that's for the American Institute for Preventive Medicine. We're able to provide employers with a projected return on investment analysis so that if you email us how many employees you have, we can project based upon 27 studies that have been done on our various self-care programs where the average savings has been about $83 per employee, what you might expect to see within your company. But clearly, the more we can do to educate our employees to not only make better decisions about when to access care, but better decisions about once they do go see a provider or they are hospitalized, what types of questions to ask so that they get the best possible care possible, all goes into a good, sound medical self-care program and empowers our patients to be better consumers.
Well, Don, thank you very much. Really enjoyed having you on this segment. Enjoy the holiday season, and maybe we'll see you at our May Forum here in Atlanta.
Sounds great. I look forward to it. And you, Ron and Doug, great holiday to you as well.
Thanks. And audience, stay tuned for the next segment of Healthcare Consumerism Radio.